our client has found their way to lay under the correct sheet in the correct position, and that in itself is an achievement. One thing I do stress is initially coming in with the client, showing them the bolsters and everything, because like we have that rolled up towel covering the side of the body, as well as a pillow for under the abdomen. They want to, clarify and really show that, very clearly demonstrate that this is the sheet I want them under, all that stuff. And then I leave the space, let them get settled, wash up really good, come in, and then if I have to navigate the environment like that, then the very first thing I do want to do is come in and sanitize. And that'll be just kind of the standard practice. And it didn't have to even be my forearms, it's just where I made contact with. As long as I wash my arms really diligently. Next is bolster. And it works as kind of an initial contact cycle. Part of this initial protocol that we're learning is going to be even like making initial contacts and some of the little soft touches. So grabbing the heels, and then make sure I know where my bolster is. I'm a fan of going all the way to the fitted sheet, scooting my hand up underneath their feet because I can hold them like that. Then my arm is creating a window, pocket that I can slide this in, then down. I'll grab their heels and kind of make that feel like massage. I can see where the bolster is. I want the heels to pretty much line up right there with the middle of that round bolster. My goal is that the tops of their feet sit on the bolster. Nice heel squeezes. And just resting is considered technically a technique. But a cycle of contact that you do every time, like this is just built in. Heel squeeze, behind the knees, up to the low back. Done that for 22 years. And come up. From an initial assessment standpoint, one of the easiest things is to just try to see what their scapulas are up to. Okay, so you have your skeleton chart to reference, but if I can find the inferior angles of those scapulas and my thumbs on the medial borders, and I can just look at my hands, and rather than being very mechanical about this is just an example. How do I make assessment? Part of what we do through this process is going to be a lot of joint movement and assessment being shown and talked about, but making it look and feel like massage. So here, I'm looking at the scapulas and seeing, all right, this one's elevated, this one's down. But while I do that, rather than just kind of being too static, I can easily kind of just incorporate a little bit of movement and be like, okay. And this is a soft touch element that kind of mimics an area that a lot of people want you to work on, that hole between the spine and the scapula. And I'm just, whatever foot is forward with my palm, that's my primary working hand, right? So these little angles, I'm just starting at the spine, going towards the scapula. It's just a nice way to kind of initially start, interface. It gets me around the whole table. Here. Next is going to be repositioning the arm, and I'm confirming our chart. We started on the left side of the body in our chart. Okay, now repositioning of the arm, because one, it's going to make it easier to interface with the low back to the lower thoracic area, because then I don't have to worry about hitting their arm. Two, I'm going to be able to assess the shoulder a little bit as we go. To undrape it, your best thing to do is to actually just find their body under the sheet, find their wrist and hand, start there. Okay, I'm going to take your arm off the side of the table just so you can see better. It's a little bit of a better kind of process. Find their body under the sheet, contact there, and then undrape. Now, comfortable there? Mm-hmm. Okay, and then comfortable up here too?
Yes.
Cool. Now, all of that confirms that the scapula is able to move enough, and the ball and socket joint of the shoulder can move enough. There isn't anything too problematic occurring there on the shoulder joint. Okay, in terms of joint movement for the spine, little rocks back and forth are a way to create a little bit of rotation in the lumbar vertebrae. It's also, again, a little bit of an assessment where I can feel, does their body either feel like it doesn't want to rotate, or does it feel like it really wants to turn just one way or the other? All that stuff. But rocking is undervalued in the process. It does work, you know, relative to the limbic and vestibular system, just like rocking literally a baby to sleep. Why does that kind of work? But it's just rhythmic, and you can kind of just find what their body's normal kind of patterns. Like I just kind of nudge, and whatever their natural rhythm is, I kind of just try to meet that. And I can do that anywhere. It's something that helps me transition around the body. As I'm trying to get from one place to the other, I'll just kind of try to remember that tempo. When you get to having music, it makes life easier, because I will just follow the tempo of the music. Don't have, you know, thrashing of arms or anything. Okay, arms up. Now for actual draping. Make sure you bunch, like I kind of pull towards my hands as I do this, rather than just roll down, okay? Pull towards my hands. I want the sheet to ideally always be gathering on the lateral side and the medial side of the body. And that's gonna be done by kind of making sure you pull towards their body and hands and create these rolls. And that way you can move this without making secondary contact with them. Now, if I wanted to make sure there's coverage over here, you know, I have the other sheet to come up over top. There's also ways to just kind of navigate and use this, like that. And it tends to be a nice courtesy to just try to have only the areas that you're going to immediately work on be undraped. Now, as I'm already working, one key factor is I did not immediately apply lotion. It's something occasionally I do, but I use so little that I don't lose too much. But you want to try really hard for your first contacts to be without lotion, because then you'll be able to pick up various elements, like is there areas that are hot or cold. And then when we get to connective tissue elements and even lymph-related elements, I want to feel like I can kind of stick to the skin and move that and feel how well does this area compare to others, as well as like side to side, especially when we get to myofascial stuff. Now, some people, if they want the deep pressure, they want, when you hear that, like deep tissue, all of it, usually what people want is intensity. And intensity, in terms of sensation during application, can be achieved with pressure or with drag, with how much tension I'm putting on the skin as I glide across it. Now, I can stick and hold on tension and create a sense of a stretch, or I could increase that and very slowly glide. Now, just for comfort levels, there's gonna be two things I need to confirm with the client. Initially, I still wanna palpate how does the skin feel without lotion. That'll give me a lot of good information. But for our clients' just preference for comfort, I need to check in, like, now I'm gonna go into massage therapist voice, actually talking to her, and go, okay, now that tension on the skin, kind of that more stretchy sensation, is that good, or would you want more lotion?
It feels good.
Feels good. And I may double check. Even there, that's good?
A little lotion.
Okay, a little bit burning. So she and I, you know, are a bit more conditioned. So the thing is that a lot of people, sometimes you'll just dismiss that. And I'm a person, for example, that can tolerate, you know, like basically very little to no lotion. Now that was very small, that was one pump, okay? Like it was, I can't even show it. It was, I do one, it's gonna be too much. Very, very tiny. And even that's gonna be a little bit too much, so I'm gonna make sure that I distribute that. Now this is gonna be where if you're gonna put like the pretty big strokes that don't follow the best body mechanics, the distribution of lotion is where you can make it all look fancy and pretty, okay? where I can show off some of the footwork, where right foot with right leg, left foot with left hand, right with right, left with left. You know how you can just kind of keep two-stepping all the way around, right? And then that's how I distribute the lotion. And now, as you can see, I'm gonna glide much faster. Then further along, we will get into checking it in with pressure. Now, that was, I can't just, dive in. The first application of lotion and stuff did warm up the superficial tissue. I still need to work my way to kind of, at least to the first layer of muscle. Is going to be focusing more on the erector spinae of the lumbar spine. But then I'm going to sink in. I want to just focus on doing pressure, not a glide. That's going to be more that L formation. Well, yeah, L formation versus V, and I want to be coming a bit more directly down into either their body or seemingly down into the table. Tell me when the pressure is just right. Okay, right there. And I just try to mark that. Now, in order to turn this compression into a glide, I'm usually going to take a little step further away, just tiny, and then move into my knee, back heel down, and then moving toward my front foot, and maybe a little step as that glide occurs. While watching this, the glides are going to be very slow. And that was with very little lotion. So I applied some lotion, but my forearm didn't have any. So then I kind of stopped a little bit more. All that done again. Okay. So on an angle down towards the opposing, essentially the opposing hip, towards the sacrum. Here, my best suggestions are down on about a 45-degree angle. If I'm aiming in terms of where I'm looking across towards their opposite hip. And if you look at your muscle charts, I'm trying to kind of follow that big white strap of connective tissue on the low back. That's called the thoracolumbar fascia, the lumbar dorsal fascia. For some reason, I call it the lumbar dorsal fascia more. I think thoracolumbar is a bit more common. Pressure still okay?
Yeah.
Now I made a little bit of a transitional stroke here. Now I switch to my left arm, and I'm working up into the lower thoracic region, taking my steps. This is where I don't break skin contact. I'm just not too lightly, but I'm not applying much pressure. I'm just on the skin. My other arm, this is my working arm right here. My other arm is just planting wherever is comfortable for me. Squaring up my shoulders, and I do try to seat it and make contact somewhere that I think would be, pleasing a little bit. So it's there between the spine and the scapula, but it's going to be my right arm, whichever leg is forward, that's the arm that's doing the actual pressure. Work in the lower thoracic region, thinking a little bit about those ribs. I have to stay pretty posterior on the body. I don't want to get too lateral. If I do, I need to make sure my pressure isn't too directly down, and otherwise it's going to feel like I'm just jamming into the ribs. I can just modify my pressure to be more superficial and across, creating more of that glide. That does work just fine. That's going to be more of a V formation. If I want to be able to get on the sides of the body, rather like an L formation, my form more V. So I can stand pretty much in the same place and seemingly do almost the exact same stroke, but I've just changed my elbow angle, and all of a sudden I'm contacting. Now I'd be working more on latissimus dorsi, but this part of that muscle as it comes down into the low back is quite thin. It gets much thicker when we come up to the posterior armpit. But we will address that area later in sideline. Now, this is something new a little bit that I'm showing. It's like as I start to work here, I switched from my right arm to my left. Creates kind of a nice transition from here through there. And then I'm in position. I'm going to spread around and take it off to the side. Okay, good. And then I hold with my right hand their arm. This will, one, control their arm from slipping around, but two, it's going to be the area I work on next anyway. So if I'm kind of contacting here, no lotion, I'm warming the tissue up, I'm getting a little sneaky joint movement as I go. So we reposition the body, and that, did move the scapula and the shoulder joint. But as I work, if you watch, if that hand moves at all, I'm creating little tiny rotations at the shoulder joint of the glenohumeral joint. And I just work my way slowly up to the neck. And it'll feel like more is happening. I'm kind of letting this hand help hold me up a little bit. Full transparency, I just frankly am more comfortable with a slightly wider stance. So this is how I function. If your Achilles flexibility and stuff, most people should be a little bit more upward, the table a little bit higher. When I go over to the other side, I'm going to raise the table. Remember, I have pedals on this thing, and raise it a little bit to demonstrate probably what most people's body mechanics should look like. Okay. Now that arm works the best for me on this whole area. You could use this one, and working more in this area is an option. Because if I use this one, I can kind of steer my elbow, that prominence just distal from my olecranon, really just that part of your ulna, right? I can focus my pressure a little bit more closer to my elbow if I needed to really target and give more pressure in a certain area. So this will lend itself to being closer to the spine. This would lend itself better to putting pressure along the border of the scapula. So if somebody had more going on here, I could switch and use both arms. Typically I'm just here, and then I can just transition right to working on the arm. Grab the sheet, redrape the torso. I strongly suggest that you work predominantly on the upper posterior arm, i.e. if I'm really close to the shoulder joint, I'm going to work on deltoid, that kind of spade-shaped muscle. If I go lower down, then it's just the triceps. But remember that there's the nervery, pretty close, nerves and arteries on the medial aspect of the arm, which are going to be here. So if I just stand here at the head and I apply my directional forces seemingly down towards their feet, then I'm in a really safe territory working here. And I can switch my hands back and forth. Note I have that helping create a buffer, so my hands aren't going to make any burn contact. This is where I can put a little bit of additional rotation of the shoulder as I sneakily get my hand seated like that. And then if I wanted to apply more forces, another gliding compression up the triceps, then here we go. Okay. Now what I stress is to not, if you can, if a person can only lay with their arm comfortable like this, then sure you need to adapt. You need to make sure your hand stays on an angle, more on the true posterior side of the arm, all that, but don't do that. You will get the nerve and artery. So from here, bringing the arm up, and this is where I'll switch. A lot of times your applications will have your hand and your fingers essentially pointing across the midline of the table to the other side. If I do this here, my hand's going to get stuck on their body or the bolster and going to drive my elbow down into her forearm. So initially, no lotion on the skin. I'm feeling like I need just a little bit more here. So I'll kind of plant just a little bit. So that's my trick, is I tend to squeeze, get a little bit on. I'll spread it on my forearm, where if I might use it later anyway, and get it distributed. That way when I come in and apply, it's not like a one big glob or anything. A technical term. If I hold the elbow, so I'm on the left arm, cradling with my right hand under the elbow, and then using my left forearm. And then just example of making a glide really count. It's not the most exciting thing to watch, but the slower these applications, the more effective. So that was a lighter one. And I can always double check it in terms of pressure. Sometimes the pressure is just right. You're going to want to do a lot more pressure check-ins as you practice in these early days. A big part of what I usually need to confirm with a person is my innate sense of what is the right pressure, which is usually trying to get to about the second layer of muscle. If that feels about correct and comfortable for them too. It should eventually, and it will, I promise, get to the point where it feels just innately like it's about the right max amount to apply to the area. And you just need to try to either confirm that you're both on about the same page, and or recognizing that they want more or less than you would naturally kind of feel like it makes sense. So kneading is perfect here at the forearm, and it's a case where just switching my hands. It's still a push mechanic, elbows straight. I'm just switching my feet. With the lotion, the glide will happen on its own. There's a bit of a pull happening with this arm, but it's not big. It can be more that I'm just pinning the body with this pull hand as I apply pressure with my push hand, and the glide will happen on its own. You've all been doing a great job, but slow is always better. Okay. Working through the thenar group of the thumb, using a soft fist. And I'll turn, I'll line my knuckles right up with their digits. I'm thinking about the metacarpals here. And then, good. Now, we collect them underneath the sheet. And we're going to swing around. Now, I don't necessarily break contact, but this works really well, where I just draw my hand up, gonna come right back to the shoulder. Now gonna work on that upper trap area, and this is where a pull mechanic works perfectly. Just stack your fingers. I have to hook and try to make sure you're staying on the back. You should feel like you're on that muscle, not gathering to where you're getting up into the neck, okay? Gotta stay pretty posterior. What we call the sloth claw. And just lean back. The challenge with a lot of these things, the pull mechanics, and especially with kneading, which is a push and a pull at the same time, is trying to keep your elbows straight. Your elbows straight. If you do that, you'll keep your wrists more neutral and lined up. But that's one of the two. That's where people will really wreck their bodies doing this work, is that they're not usually kind of doing more like a ringing action, like they're kneading bread dough. Okay. Redrape the area. Gonna find the hand and the wrist. Confirm that's comfortable. And then up here. Great. Okay. And now we're just back to it all over again. Okay. Now we're going to actually go to Sarah's method of working on the posterior upper leg. the hamstrings, and if I go a little more lateral, some of the, a little bit on the IT band. Working here first as a bridge to going up into the hip area. So gluteus maximus and the deep lateral hip rotators. For draping the legs in this position, the most important thing, and the torso is not too hard, especially when you have that, the modesty tuber on the sides of the body. Here though, taut sheet, big wind tunnel, okay? You want to really gather the sheet towards the middle of the table and create as much bunch so that there's contact on the medial sides of the leg. And they have that confidence that they're covered. What occasionally happens is the opposite foot will also get undraped. And that's a pretty common thing for me. It gives me a lot of ability to do joint mobilization and stuff, and I don't have to worry about the sheet there between the legs. This is where I have this to help, and even if you're only doing 2 sheets, it works just fine. And the bungee just hugs, and it works out great. So that's all covered, and I have plenty of extra sheet so that when I do any kind of joint movement here, I don't have to worry, and they can always feel the sheet contacting. Now she's not laying with her feet too close together. A lot of times clients will have their legs really close together like this, and then if you are going to be trying to work, you're going to be reaching more. With repositioning them, just take the sheet, have it contacting the inside of their knee, the medial side of the knee, and then a little pull over to the side. Not a big deal, but that's how you create the impression that the draping's all good. Just pin it against their body and then move the leg. Okay. Now, in terms of kind of best practices for safety and impressions and all that stuff, if you're using your hands, don't apply applications where your fingers are going towards the pelvis. It makes pretty common sense, at least once it's stated to you, right? Using your hands works pretty good if you go down towards the knee. So I can do knees and stuff as long as everything's kind of directed at least at an angle inferiorly towards the foot. Then I can grab some lotion, so I was able to feel and palpate the skin, warm things up that way, distribute the lotion. This is a perfect case where I would maybe want some on my forearm as well. And then here we go. Incorporating some joint movement as we go. If I take the knee, so that's taking the knee into flexion, then extension. So taking the knee into flexion. If I move the leg now, this is going to be external hip rotation, internal hip rotation. So if I flex the knee and externally rotate it, I'm getting more on the lateral side of the leg. I'm getting the lateral hamstring, which is called bicep femoris, and where it interfaces with the IT band on the side of the body. Bicep femoris loves to get stuck to IT band. And since I'm going to work on the legs inside line, I can get those other 2 hamstrings in that position then. And I'm only worrying about this lateral half of the hamstrings and a bit of the IT band for now. So that's it for me working on the upper posterior leg in prone. Here I already would have the knee bent, and I can bridge up to working on the hip. So some compressions, I'm feeling for where that greater trochanter is, and I work my way slowly superior. So I know I'm on gluteus maximus. I know I'm too high if I hit that iliac crest. Gluteus maximus, and then rotations. Now I have a preference for working on the posterior upper leg, to take the leg into external hip rotation, as well as for gluteus maximus. It squares my shoulders up. If I do this, I'm not getting twisted. And I really stress including this joint movement piece while working around the hips. It makes the application actually feel like something more is happening. It Feels like massage rather than a static compression. Now I've moved down. I'm just posterior to that greater trochanter. In this orientation, I'm just above it. Now I want to be on those deep lateral hip rotators. They, guess what? They externally or laterally rotate the hip when they shorten. That'll also take the greater trochanter more up into your forearm. So if I bring the leg this way into medial or internal rotation, I will stretch those muscles and I will roll that trochanter away. And now through those applications, I concentrated a bit on external, lateral rotation of the hip, and now medial, internal rotation of the hip. Most people need a lot more of this. Sarah is an alien in having good hip rotation. Most people with low back dysfunction and or hip issues, you will find lots of external lateral rotation, and then you'll hit a barrier here, and there'll be very much less internal medial rotation. Okay, and there I am. Now I'm in contact here, so as I just bring the leg down into the bolster, I can sequence in very nicely to working on the calves. The one that you're really paying attention to here is the most superficial one called gastrocnemius. And it works both at the knee and the ankle, just like the hamstrings work both at the knee and the hip. Now, similar to what I said about the hamstrings, I know I'm going to work more on this structure, specifically gastrocnemius, of this whole posterior lower leg area and sideline. So I'm only worried about the lateral aspect of it. I'm thinking the lateral head of gastroc. If you look at the picture, the anatomy pictures, there's a line dividing it right down the middle, and it splits and connects right behind the knee up onto the femur. Then it comes down and unifies and becomes, along with soleus underneath of it and plantaris, they all come together to become the Achilles tendon. And rather than coming down right on top of the muscle and seemingly pushing it and or the Achilles into the bones, I'm coming more on the side of it and trying to push things to slide across. Okay, and we're done there. Some heel squeezes. We're going to work on the feet way more in sideline. Here though, if I'm gonna, I would just do more of this if I was having to work on the feet in prone, but getting a hold of the heel, which is going to be calcaneus, feeling for a little bit, there's a bony protuberance of the fifth metatarsal, which becomes the joint for the pinky toe. Big bony projection there, there's muscles that attach right there, and down on the side. So a little bit of pressure right there in between, as well as squeezing the heel. It's effective and it feels good. Then this hand comes over, wraps right around what people call the ball of the foot, the end of the first metatarsal, which is where the big toe joint comes in, and I'll do kind of a kneading action on those. Swing around, a little bit of toe spread. If I work on the toes, I line all my fingers up with their little toes, grab them all together, and then just take those toes into flexion and extension as I come around and squeeze the other side of the heel. And just a way to kind of work on the foot as I go around the table. Done. Redrape.